The journey of caring for a loved one is something so many of us will face or maybe are facing right now. It's full of love, sure, but also real sacrifice and sometimes just immense challenges. But what happens when that care involves something like Alzheimer's, which is just
Wow.
relentless? And then what if you add things like cultural expectations, maybe language barriers, even systemic issues on top of that already complex situation? Well, today we're taking a deep dive into exactly that: Latino families and Alzheimer's caregiving. Our main guide for this is a really powerful lecture by Dr. Michael J. Lucia called Caring in Silence. It sheds a lot of light on the unique hurdles, the incredible resilience, and it offers some real strategies for better support. So our mission today is pretty straightforward. We want to pull out the most important insights, give you a clear picture of how culture, family duty, and professional practice all kind of intersect here for Latino caregivers. Okay, let's dig in. So just to get us all on the same page before we dive deeper, what exactly is dementia? Is it just one thing or?
Yeah, that's a great place to start because, dementia isn't really one single thing. It's more of an umbrella term. It covers a whole cluster of symptoms. And these symptoms come from basically age-related brain disorders where neurons are dying off or just not working right.
Okay.
So we're talking impairments in memory, of course, but also language, judgment, reasoning, even motor skills.
Okay.
And often you see big shifts in personality, mood, behavior too. It's really way beyond just, forgetting your keys. Now, for adults 65 and older, the most common form by far is Alzheimer's disease, AD.
Right.
That primarily hits memory, language, and cognition. And it gets progressively worse. It's linked to those plaques and tangles you hear about and certain genetic risks. But, and this is crucial, it's just one type. You also have vascular dementia. That's the second most common.
Okay. Vascular. So related to blood flow.
Exactly.
Yeah.
Reduced blood flow in the brain, often from strokes or high blood pressure. And then there's Lewy body dementia. That one can cause these really unpredictable swings in thinking, visual hallucinations, movement problems.
Right.
It's very challenging.
Wow.
And less common, but still significant, frontotemporal dementia, which often affects younger people, maybe 40s to 60s, and can really change social behavior and language skills.
That's a much broader picture than I think most people realize. It's not just memory loss. And I remember reading something kind of surprising about repeated head injuries, like in sports. That can lead to dementia too.
Absolutely. That link between repeated traumatic brain injuries, TBIs, and dementia symptoms showing up years later, it's a really important piece of the puzzle.
Right.
It just underscores how diverse these conditions are, both in origin and how they show up. Understanding that diversity is really the first step towards effective, compassionate care.
Okay, that makes sense. So with that landscape in mind, let's focus on the caregivers,
Yeah.
the people actually doing the work day in and day out, specifically within Latino communities. Who are we talking about here, and what do the numbers tell us? Right. So when we say caregivers for this discussion, we're talking specifically about the unpaid family members, spouses, children, siblings, other relatives, the ones providing that essential daily help. And just quickly, on the terms Hispanic versus Latino, it's worth clarifying.
Yeah, good point.
Hispanic usually relates to Spanish-speaking cultures, Spain, and its former colonies. It's a term the U.S. government uses, but it gets criticized sometimes for, lumping very diverse groups together and emphasizing the Spanish link. Latino or Latina, Latinx, comes from Latino Americano. It's broader, covering people from Latin America or their descendants, acknowledging all the different backgrounds: European, indigenous, African, Asian.
Okay.
Though, honestly, many people prefer to identify just by their country of origin, like Colombian or Mexican or Puerto Rican.
Got it. So the numbers.
The numbers are, well, they're pretty staggering. Across the U.S., you've got about 66 million family caregivers total. And nearly 15 million of those are caring for someone with Alzheimer's or another dementia. But here's the key thing for our focus. The Latino population is the fastest growing in the U.S. And the number of Latinos aged 65 and older, it's projected to skyrocket from about 2.5 million back in 2007 to potentially 17 million by 2050.
17 million. That's huge.
It is. And that means by 2050, we think around 1.3 million Latinos could have Alzheimer's or other dementias, which translates into this massive, urgent need for more informal Latino family caregivers.
Then what about right now?
Right now, about a third of Hispanic households report having at least one family caregiver. That's over 8 million people. And here's a really significant statistic. 74% of those Latino caregivers are female.
74%. That's much higher than the overall average, isn't it?
Much higher. The national average is around 60%. And these women are often, in their early 40s, caring for loved ones, averaging around 62.
That paints a very clear picture. The scale is immense, and the demographic trends just amplify it.
Mm-hmm.
But like you said, numbers don't tell the whole story, do they? The daily reality.
Mm-hmm.
Our sources say Latino caregivers face some really unique, often profound challenges. This is where it gets tough.
It really does. For starters, Latino communities in the U.S. are seeing disproportionately rising rates of Alzheimer's disease. And the caregivers, they're dealing with elevated stress. Not just from the disease itself, which is hard enough,
Right.
but also from these strong cultural expectations around caring for elders. Then you layer on things like health disparities that already exist, racism, immigration stress, language barriers.
It just compounds everything.
Exactly. It takes a serious toll physically and psychologically.
So it's not just about, say, not speaking English well enough to talk to a doctor. It's deeper.
Oh, much deeper. It's often a lack of culturally competent care. The system doesn't always understand or respect their context. And that leads to what Dr. Alicia calls caring in silence, a major underuse of formal support services.
Why is that? Why the underuse?
Well, it's complex. Partly it's cultural preference, a strong value placed on keeping elders at home, avoiding institutionalization. But it's also rooted in very real concerns that their loved ones might not receive culturally sensitive care in those settings.
Understandable.
Then add practical barriers, limited access to good information, lack of resources for long-term care, transportation issues, especially in lower-income communities.
Yeah.
And yes, limited English proficiency is a huge hurdle in navigating the medical and social service systems, making critical decisions about care really difficult. And the impact on the caregiver's own health, it's significant.
Also,
Latino caregivers consistently report higher levels of physical and psychological distress compared to non-Hispanic white caregivers. Things like depression, anxiety. Studies show their physical health often worsens. One found 17% reporting worsened health since starting caregiving.
no.
And long-term caregivers. Nearly a quarter rate their own health as just fair or poor. Caregiving can even impair immune function for years after it ends.
That's incredible.
And compared to white caregivers, Latino caregivers are often younger, have less formal education, are more likely to be underemployed, and generally start out in poorer health themselves.
And you mentioned living arrangements earlier.
Right. 43% of Hispanic caregivers live with the person they care for, compared to about 32% of non-Hispanic caregivers. That closeness can increase the burden. And that gender disparity we noted, the 74% who are women, they tend to perform more tasks, report more problems, experience greater distress. They're at higher risk for stress, depression, chronic health issues, even substance use and higher mortality rates, often because they neglect their own self-care.
It's a heavy toll.
It is. And many are juggling this with jobs. The average is 20 hours of care per week, but 13% are doing 40 hours or more, basically another full-time job.
How does that even work?
Often it doesn't work well. It frequently impacts their employment changing schedules, taking leave, sometimes losing their job entirely, and the financial hit can be devastating. Nearly half report using up their personal savings.
That's just an overwhelming list of pressures. It really makes you wonder, how do people possibly navigate all of that, especially if the support systems aren't really set up for them?
It sounds incredibly difficult, and it absolutely is. But, what's really compelling and hopeful is that the sources also highlight these powerful sources of resilience within Latino communities, things deeply rooted in culture and belief.
Okay, so amidst all those challenges, where does the strength come from? What helps people cope?
Well, amidst all that difficulty, there are these really strong pillars. One of the most significant is something called familismo, or familism.
Familismo, okay.
Yeah, it's a core cultural value. It emphasizes family-centeredness, thinking collectively, interdependence. Family isn't just parents and kids. It includes aunts, uncles, cousins, even godparents, comadres.
Comadres, the extended network.
Exactly. And familismo has this really fascinating, almost dual impact on caregiving. On one hand, it frames caring for elders as a fundamental duty, a core part of family loyalty. This leads Latino caregivers to report feeling a greater sense of responsibility. But here's the paradox.
Okay.
They often report fewer perceived caregiving burdens compared to, say, non-Latino white caregivers.
There are burdens, even with all those challenges we just talked about.
Perceived burdens, yes. Even when, objectively, they might be facing more challenges due to disparities in income or access to help. The cultural script frames it differently. It's seen as a valued role, something you do out of loyalty. Many feel that not doing it would bring shame to the family.
That's, wow. Familismo sounds incredibly powerful as a motivator, a source of strength. But I wonder, does the source material touch on whether that intense sense of duty ever becomes Well, a burden in itself,
Hmm.
especially when things get overwhelming. It sounds like it could be a double-edged sword.
That's a really insightful question. And yeah, it's a critical nuance.
Right.
While feminismo is definitely a source of strength and drives that commitment, the potential for it to become a hidden burden is real. The lecture doesn't explicitly detail, say, the negative side of feeling obligated when you're stretched thin, but by highlighting things like the underuse of formal services and the high stress levels even when perceived burden is lower,
Okay.
it implicitly points to that tension, right? Where that cultural duty might lead someone to suffer in silence, maybe feel reluctant to seek outside help because it could feel like a personal or family failure.
I see.
So yeah, it's fascinating how it acts as both this powerful driving force and potentially a shield against feeling burdened, even when the reality is incredibly tough due to all those external factors.
Makes sense. Are there other sources of strength mentioned?
Definitely. Religion and spirituality are huge. They're really central in many Latinx cultures and serve as vital coping resources. You see common practices like prayer, reading the Bible. People draw strength, comfort, guidance from their faith to handle the emotional challenges.
And spirituality might be separate from organized religion for some.
Exactly. Spirituality is more that internal search for meaning, for the transcendent, believing in something bigger than yourself. It's a faith that affirms life, and it can exist with or without formal religious practice. And research backs this up. These spiritual factors are consistently linked to better mental health outcomes. They can be really therapeutic, especially for older adults, minorities, people facing crises.
Interesting.
And one more point for some male caregivers, the role itself becomes part of their identity. They might approach it almost like a job, taking pride in doing the tasks well, efficiently. It reinforces their role as a husband or provider and affirms their value.
That's a powerful look at resilience. Especially important when you consider how long this commitment often lasts. Because Alzheimer's caregiving isn't usually short-term, right? Let's talk about that longevity and the really tough decisions families eventually face, like long-term care options.
You're absolutely right. The duration is often much longer than for other conditions.
Yeah.
Among dementia caregivers, something like 43% have been providing care for 1 to 4 years already, and nearly a third, 32%, for 5 years or more.
5 years plus, that's a marathon.
It truly is. And when we talk about long-term care, what we mean are the services and supports needed over extended periods. Help with basic daily activities, bathing, dressing, eating, and also instrumental things like housework, managing meds, making meals. The options vary. Staying at home is often the preference, maybe with help from family or paid aides.
Okay.
Then you have specialized places, often called memory care units. These are designed specifically for people with Alzheimer's or dementia. They usually have more staff, specialized training, activity programs tailored to cognitive issues, but they also tend to be more expensive.
Right.
And then there are skilled nursing facilities or nursing homes. They offer more comprehensive medical care and supervision, often for people with serious illnesses or after surgery.
And this is where that cultural value, familismo, comes back in and creates tension, isn't it?
Exactly. We know the need for long-term care is growing, maybe 14 million people in the U.S. needing it by 2030. But for many Latinx families, because of familismo, the idea of placing an elder in a nursing home just isn't the norm. Certainly less so than for maybe African-American or non-Latinx white families.
That's seen as a last resort.
Very much a last resort. And the decision, if it comes to that, can be incredibly stressful. There's often intense guilt, feelings of abandoning their loved one, plus all the negative stereotypes about institutions. And even if a family wants to explore formal long-term care, they run into those structural barriers again.
Like what?
Language limitations are huge. Not having adequate insurance, low income. Sometimes immigration status is a concern, or simply not knowing what services are even available or how to access them. Plus, other things factor into how much help the person actually needs, the caregiver's own health and stress level, their support network. It all influences those really tough decisions.
It really highlights this gap, doesn't it, between
Yeah.
the deeply held value of keeping family at home and the practical realities that might eventually necessitate other options, especially with all those barriers in the way. So how do we bridge that gap? How can we better support these families in a way that respects their culture, but also addresses the practical needs? I feel like we need solutions that really get it.
Yeah, and there absolutely is hope, and the sources do point towards solutions. First off, the power of social support is massive.
Just having people around you.
Exactly.
Yeah.
Good social support significantly reduces caregivers' depressive symptoms. More support equals less depression, less perceived burden. It buffers the stress. And we also need to remember the positive sides of caregiving. It's not all negative. Many caregivers genuinely find fulfillment in carrying out their family duties. They feel closer to their loved one, gain a sense of competence. These positive feelings are actually linked to lower burden, less depression, better health for the caregiver. Most report something positive companionship, meaning feeling important.
That's important to highlight.
Absolutely. And from a positive psychology angle, fostering that positive outlook, focusing on gratitude or fulfillment, can actually buffer against the negative health outcomes, even the increased mortality risk.
So lean into the positives where possible.
Right. So, what are the concrete strategies? The lecture calls specifically for evidence-based, culturally responsive resources, things that actually work and fit the cultural context. This needs to happen across social work training, within organizations, out in the community.
What does that look like practically?
It means practical strategies for caregiver self-care, building strong peer support networks where caregivers can connect with others who understand, advocating for policies that are culturally informed. And crucially, this came up again and again, culturally sensitive outreach. You have to address the language barriers head on to get caregivers to actually use services, both for themselves and their relatives.
Makes sense. You can't use what you don't know about or can't access.
Precisely. And the conclusion really hammers home the need for better, culturally attuned training for professionals. Doctors, social workers, nurses, they need to understand both the emotional challenges and the access barriers these families face. We need a system that gets it, that respects the cultural dynamics.
So really what this boils down to is, yes, the challenges are immense, truly immense, but that resilience, those coping mechanisms rooted in culture like familismo and spirituality, they offer a really powerful foundation. And the way forward seems to be building targeted, culturally competent support on top of that foundation, leaning into those inherent strengths, not ignoring them. Okay. So you've just taken a deep dive with us into a really important, often complex area of the world of Latino families caring for loved ones with Alzheimer's. We've looked at the huge challenges, the numbers, the different types of dementia, but also, importantly, those powerful cultural strengths like familismo and spirituality that help sustain these caregivers. Hopefully you've gained some insights that go beyond just the surface, giving you a clearer picture of both the struggles and that incredible resilience. So here's something to think about. This deep dive really illuminated the profound commitment of these family caregivers. What stands out to you about that balance they strike between that deep cultural duty, the immense personal sacrifice, and finding strength in their community and faith? And maybe more broadly, as our society gets older and more diverse, how can all of our communities, all of our healthcare systems, learn from and adapt to the unique strengths and needs we see in diverse caregiving cultures like this one? How do we make sure no one ends up caring in silence?